And we are live. So good evening, Facebook, and good evening, YouTube. And a really warm welcome to tonight's Modality Wokingham patient engagement session on the changes that are coming to our two practices over the forthcoming weeks. So we'll do some introductions first. I'll go last. Kate, take it away.
Hi everyone, I'm Kate Nancy. I'm the area practice manager for both sites in our Wokingham division.
Hello, I'm Helen Rutherford. I'm another GP from Wokingham. Some of you will have seen me at Burma Hills recently. I'll be keeping an eye on the chat this evening, and we'll put any questions that you have to Dr Bhardwaj and Kate.
And I'm Vipan Bhardwaj. I'm one of the partners. So I became a doctor in 1993 and became a GP in 1999. And I joined the practice in Wokingham in 2005. I'll be doing the screen presentation tonight. So without further ado, I will share my screen and hopefully perhaps those who are on could just give me a yes to indicate that this is being shared. Okay.
Yes, it's there.
Perfect, thank you. Okay, so we're going to cover a little bit of ground, and the main portion of this is really about the IT merger that is going to be happening to our two practices in a few weeks' time. The exact date I'll go on to in a few slides' time. So we'll cover the next steps. Hopefully, most of you will have already received either by text or by post a letter indicating the background to this, and also a fairly comprehensive list of frequently asked questions, and I can go over those again today. But the main purpose of tonight's session is to be able to answer any further questions that anybody has. I will very briefly, just indicate the current state of general practice. It's always helpful, perhaps, to understand a little bit of the background and some of the longer term trends that have occurred. So that's what I'll start with tonight. And I just mentioned the fact that I've been at the practice since 2005 and a GP since 99. And it's obviously it's a cliche to say that everything changes, nothing stays the same. And so there are always some short-term fluctuations, but there are also some much longer-term trends, for instance, over 20 plus years. So as you can see here, some of the short-term trends, we've got slightly fewer partners than we had last year, but obviously substantially fewer partners than we had when I joined in 2005. And that's a long-term trend across the whole of general practice. We've got more salaried GPs. The salaried GPs, we only had one when I joined the practice in 2005. And you can see there's some fluctuations with the other members of the clinical team. Now, the long-term trend is the next chunk, which is what we call the allied healthcare professionals. In 2005, when I joined, there were none of these folks. Urgent care practitioners were people who basically drove ambulances. Pharmacists were pharmacists in retail pharmacy. Physician associates we didn't have at all. They were in the US, but not here, and so on and so on. And so you can see this is the really big long-term trend over the last few years. And those of you who have what we call long-term conditions like diabetes and heart disease and asthma and so on, will have had communication from this group of our staff. So although they're not clinical, they have an absolutely pivotal role in the organization and the timetabling of long-term care patients with long-term conditions. And of course, goes without saying, one of the other massive changes that's occurred during the last 20 years is the use of technology. using platforms like eConsult and Push Doctor, patients can engage with the primary healthcare team, as we now call it, virtually, either by effectively a sort of an email or by a video platform. We're using SMS messaging much more to convey results, and also other elements, things like fit notes. Also, over the last couple of years, the SMS platform that we use has the ability for patients to self-book, which means that there's no sort of having to hang on to the phone. Talking of phones, the phone technology has frankly changed dramatically. We at our practices have had what's called cloud-based telephony for some time, but over the last couple of years, the technology has evolved to enable callback facilities, so people aren't necessarily waiting for an inordinate amount of time. And the NHS app is really quite a good app. I've said on one or two occasions that actually it's evolved over its lifetime to be now quite a useful app. Patients can see large bits of their medical record, order medications, and so on. These are dramatic changes that have enabled the practices to work in quite a different way to that was done in the past. Now, some numbers. Now, again, on the theme of long-term change. Now, a lot of folks will probably not be aware that the NHS has a board. And this gentleman in this screenshot is the chair of the board. His name is Richard Medding. The board meets on a regular basis, and some of those meetings are live streamed onto YouTube. And you can see there's a link here. This particular one from October 22, Richard Medding's referred to some data which really quite eye-opening. So you can see on the right-hand side, since 2010, the number of those people over the age of 70 has increased by almost a third. In less than a decade and a half, the number of those over the age of 70 has increased by 30%. And at the same time, those of the over 70-year-olds who have long-term conditions, such as asthma and diabetes and heart disease, that's actually increased by around 2/3. So one might say, entirely appropriately, the number of hospital consultants has somewhat matched that increase. Unfortunately, the number of GPs has not, and to a large extent it's gone down at the same time. BMA data that Richard Medding didn't refer to, and that's why I've sourced it separately here, you can see that over since 2015, so almost 10 years, the number of fully qualified GPs has actually dropped. And that's borne out by these graphs, which are supplied courtesy of the Institute for Fiscal Studies. Now, some patients may recall that name. This is a finance think tank, and these are the guys who are usually called upon to comment in the immediate aftermath after a budget. So the Chancellor sits down after his budget speech, and the BBC broadcasters turn around to somebody in the studio, often from the IFS. Not a healthcare organisation, but a finance organisation. But the state of the NHS is obviously sufficiently dodgy that they thought they better take a look. And so what you see here is the number of full-time equivalent, FTE stands for full-time equivalent staff in the NHS, compared in 2022 compared to 2019. And what you see here is the increase in secondary care. So nearly 10% more consultants from 2019 to 2022, 15% more junior doctors, nearly 10% more nurses, etc., etc. But what you see is a drop in GPs. And that's just in 3 years, a 2% drop in GPs, whereas in hospitals, the number of staff has risen quite substantially. And this part is really what caused the IFS to scratch their sort of collective heads. Over the same period of time, the number of patients being seen in the hospital sector, in outpatients, in A&E, etc., has actually gone down, whereas the number of patients being seen in general practice has gone up. So fewer GPs, but more patients being seen in general practice, whereas in the hospital sector, the number of patients going down. Now, admittedly, this report was published in December 22, so it's now a little over a year old. What the situation is now I don't know, but what we do know is that waiting lists are at record levels, and this is courtesy of the House of Commons Library, and it's pretty bang up to date data from November 2023. And as you can see, the number of people waiting for hospital treatment is approaching 8 million, and that is an all-time record. And that's not something that is just a matter of statistics. It's not just a sort of a dry academic matter. This has real-world effects, and it has real-world effects on our patients. And as you can see here, this is from a trade magazine, if you like, GP magazine. 1 in 3 appointments in general practice are thought to be as a result of waiting list related issues. For instance, somebody might be waiting for a hip replacement and they're in ever increasing pain or stiffness or whatever it may be, and they may then consult their GP for more pain relief, maybe a physiotherapy referral, etc. 1 in 3, it's thought that 1 in 3 appointments. And if we just reflect on the fact that general practice across the country provides about 1 million appointments per day, you can see that's an awful lot of appointments that are related to this. And then the final slide in this section is, again, a sort of a longer term trend. Over the last 10 years, over 700 practices have closed. And that is a trend that you can see here has been fairly consistent. And in 2022, which is the last year that we have data for, it was roughly running at about 1 closure per week. The key factors tend to be financial viability and the inability to recruit. And what this shows, this number here, is basically saying that the average patient list size of the practice is about 4,000. So it tends to be the smaller practices that fold. They're the ones that close because they've become financially unstable, and there's not the ability to recruit. And FYI, as they say, the Burma Hills surgery practice list is about 4,000. So that moves us on to the main sort of topic, which is the IT merger. Now, most of our patients in Wokingham know that since December 2018, it's effectively been 2 practices, but 1 organisation. The Wokingham Medical Centre staff have worked at Burma Hills surgery and vice versa. There's virtually nobody who has been based at one site exclusively. So the clinical teams and the back office teams. And so what happened in the immediate aftermath of the former GP needing to retire in December 2018 is that one of our colleagues, Dr. Ishaq Jalisi, sort of decamped to Burma Hills to sort of run it somewhat single-handedly, albeit with our support. But in January of 2022, he didn't just leave the practice or the town, he left the country and he emigrated. And so Dr. Bara, many of our patients know and love Dr. Bara, who was our senior partner, took it over. Sadly, 2023 was not the best year for him for health, and he retired just a matter of weeks ago in January 2024. And it'll come as no great surprise that because of the size of the practice, despite the sort of the support that we provide, recruitment has not been successful. So we had some discussions with the representatives of the NHS locally. They're called the Integrated Care Board. We abbreviate that to the ICB. Now, there are various options. There are always options in a situation like this. Would another practice sort of parachute in and take it over? And there frankly is nobody else. Well, you know, one could potentially just close the practice, we didn't really want that to happen. The ICB don't really want that to happen, and I suspect a lot of patients don't. So that's got a big red cross, and that brings us to the IT merger. And in a sense, this is almost a sort of the final jigsaw piece. Everything else to some extent has been merged. The clinicians, the non-clinicians, the processes. What has to happen now is the patient record, what we call the electronic medical record of the two practices, now has to merge, and the ICB have approved that. So the next steps are to, in a sense, to do what we're doing. So the patients have a representative group that's called the Patient Participation Group, usually abbreviated PPG, and we met with them on towards the end of January and briefed them. With their blessing, as it were, we then had the Burma Hills surgery patients texted with the notification letter shortly afterwards, and we were then obliged to advise what are called the system stakeholders. What are the system stakeholders? Those are people like the hospitals, the ambulance service, the district nurses, the council, the MPs, those kind of folks. So they've all been notified as well. Wokingham Medical Centre patients were then texted last week. That's a much larger group. So that was about 20,000 sort of texts that had to be sent out. And obviously we're doing this tonight. This will be recorded onto the Wokingham, Modality Wokingham Facebook page, and it'll also go onto YouTube as well. So for those who want to look at the sort of the FAQs that I'm going to come to in a few slides' time, that can be done in a sense at your leisure. The members of the PPG have very kindly helped to run some drop-in Q&A sessions for those who want to come in and talk to somebody. We'll be running those. Dates to be confirmed during February and March, and there'll be some updates, regular updates over the course of the next few weeks on our Facebook page and also on the practice websites. So now a little bit more detail. So the date of the merger is the 18th of March. Now that we had no control over that. In effect, the ICB and the IT people gave us that date, non-negotiable. Had we had the choice, we probably wouldn't have gone for that date, but it is what it is. That's what we worked with. And that's a Monday. So what has to happen is at 1 p.m. On Friday the 15th, which is the preceding Friday, Burma Hills effectively gets switched off. And what then has to happen over the course of the afternoon of Friday the 15th and the whole of the 16th and 17th, Saturday and Sunday, the two patient databases, which is in effect what they are, have to be merged. Now, I put it like that and it sounds kind of simple, but actually it's quite a big deal. There's a lot of stuff that has to go on in the background, and it will take a little while to do. So that will be happening over that weekend. What then happens is that site, which we will then stop calling Burma Hills, because Burma Hills becomes a little meaningless at that stage, we're then going to focus on its geographical site, and it's on Ashridge Road, so we're going to refer to it as the Ashridge Road site. That will then reboot on Monday morning. Now, what we're told by the IT people is that rebooting process in the past would take days. We're now told it should take hours, but we don't know exactly how long. So we will be kind of on tenterhooks, waiting for that sort of reboot to occur. So that's very much what will happen on that day. So I'm now going to pause and just check in and see whether there are any questions. If there are not, then I'll just go on to the FAQs.
So everybody's very shy and there are no questions. You've obviously done a really good job at explaining it. So I would probably just go on to the FAQs now.
Okay, thank you. All right. So So the document that we sent out was deliberately quite detailed, and maybe that's why there are no questions. So there are a lot of questions that we've attempted to sort of preempt. And one of the sort of obvious questions is, for somebody who has hitherto been seen at Burma Hills, where are they going to be seen? And the answer is at either site. That's the beauty of having the IT systems merged, is that from our perspective, we will have what we call one appointment book. And so somebody who lives, near the Ashridge Road site, as we'll be calling it, will be able to be seen there. But somebody who, for instance, lives nearer Wokingham Medical Centre, for instance, on Rose Street, could actually just be seen there, and vice versa. Somebody who's currently a Wokingham Medical Centre patient, but actually lives nearer Ashridge Road, around that kind of area, the new estates, can be seen there. Absolutely fine. The name GP issue is that, as I said, the databases will effectively be merged, and so the patients who are currently at Burma Hills surgery will be sort of distributed under the doctors who are across both sites. Parking is always an issue, particularly at Wokingham Medical Centre. It's a town centre site. There's relatively limited parking. There is some, and so we've sort of mentioned that here. There are sort of pay and display car parks, as well as on-street parking. A reminder to everybody that the parking for patients at Wokingham Medical Centre is for disabled patients only. It's not a sort of a general purpose, because it's such a constrained site, and we now have a lot more, of our own staff that need to park there. Parking at Ashridge Road site, on the other hand, is a little bit more available. So that's perhaps one advantage of being seen there. The prescription issue is one that requires a little bit of care, and for those who have a nominated pharmacy, that nomination will not carry over during the merger. So there are in IT speak, there are tasks, and tasks do not carry over, and this is one of those things. So it's hopefully a relatively small thing, but it will be the case that the nominations will be erased during the merger, and our administrators will renominate the pharmacy. That's not going to happen within sort of minutes and hours. That will take a little while. So something similar applies to medical records access. So a lot of patients will use the patient access app, and a lot will use the NHS app. We've been told that the patient access app will need resetting, and that resetting process is a lot more laborious than the NHS app process. So there's good news for those who are using the NHS app. That will be a relatively swift reset at the patient end. And so basically we're just doing, in a sense, we're saying that what we always say, which is to encourage people to use the NHS app, because it's just much more multifunctional. The final question on this slide is, what other sort of options are there other than seeing a GP? And this is just not necessarily anything to do with the merger, although it's probably the case that as we go into post-merger, Burma Hills patients will start to sort of see more of these sort of folks being involved in their care. And that's been less so, certainly if we go back to sort of pre-2018, Burma Hills didn't have so many of these people available. Will the surgery still be open for appointments? Yes, it won't be called Burma Hills anymore. It'll be the Ashridge Road site, but it'll still be certainly open for business. we will find out post-merger exactly what sort of what the sort of in the uptake of appointments there will be. It's slightly hard to anticipate. So at the moment we're setting the appointments up so that they are GP appointments in the mornings, and perhaps the allied healthcare professionals in the afternoons. A lot of Burma Hills patients have been coming to Wokingham for the group sessions that we've run in the evenings, but we've also had feedback that some patients would prefer to have those group sessions in the daytime and not so much in the evening. That's very difficult to do in the waiting rooms when they're sort of full of people being seen. So it may be possible to actually do that at the Ashridge Road site in the afternoon. This will be something that we will just reflect on over the weeks and the months and the years after the merger. The practice catchment area won't change. It's exactly what it is now. We will have the same area. There is at the moment what we're planning is for both surgery numbers to be in use, although it may well be the case in the future that we start to just streamline things and just have the one phone number. E-consult will continue to be in use, and that the Wokingham Medical Centre website will be the one. I'm just being messaged while I'm talking, for me to clarify some things that I may have just inadvertently sort of made a little fuzzy. So the issue with the prescriptions is purely for the Burma Hills patients. So I said that the nomination would need to be reset. That's not for the Wokingham Medical Centre patients, that's just for the Burma Hills patients. I've already mentioned patient access. Yes, it can be used, but it will need a bit of a reset. Many patients have used the app that we've made available to all of our patients in order to access a health and wellbeing coach. That's completely unaffected by the IT merger. So if you've been using it and you've been engaging with your coach, that's completely unaffected. No change there. Push Doctor will still be available. There shouldn't need to be any kind of reset or anything like that. I've already sort of mentioned about where the appointments will be. And we have noticed one or two Burma Hills patients already attempting to re-register at Wokingham Medical Centre almost in advance of the merger. There's absolutely no need to do that. In fact, we would positively discourage you from doing that, because that will make our lives post-merger a lot more difficult. So please don't do that. The records will just transfer automatically with everything being sort of transferred across. So please don't try and re-register. That makes life a bit more complicated. There's a sort of a question here about, why is this happening? And hopefully this session has just dealt with that. There are pressures on small practices, and we're sort of 95% merged at a macro level. Anyway, this is just the last jigsaw in the puzzle. And the last two questions just reflect that really over the course of the last couple of years, particularly sort of COVID onwards, there's always been a bit of fluidity. So Burma Hills patients are now quite accustomed to coming to Wokingham Medical Centre, having some nursing appointments. I've already mentioned the group sessions, but equally some of the Wokingham Medical Centre patients have gone to Burma Hills to see the doctors or the clinicians there. So this is already something which a lot of patients are entirely comfortable and familiar with. And in terms of the presentation, that is the end of that. I will stop sharing my screen. Hopefully I've stopped now.
You have,
okay.
And there are still no questions.
Right. Gosh. Okay. We've stunned
Wait a little bit in
everybody.
case some questions come on, but there are none. So I think everybody's had their questions answered, hopefully.
Okay. Fine. Well, we've sent out across the two practices about 22,000. Is that right, Kate?
About 22,500 probably in total.
Okay. And so that's a fair amount of messaging that's already gone out. The video will be available for anybody to view after the fact, both on our Facebook page and also on YouTube. And as I said, there will be updates probably on a weekly basis, unless something untoward happens, starting from next week onwards, down to the day itself. And the merger will take place on the 18th, but Burma Hills gets switched off on Friday the 15th. So there'll be an update that week. The key things really for most patients are regarding medication. Do either of you want to clarify anything that I perhaps muddied?
I actually think it was very clear, and I hope patients found that.
I think the only thing is just to say that Burma Hills will be. Sorry, Kate, you go ahead.
No, I was just you carry on. I was just going to say the nominations for the patient nomination for the pharmacy nomination. I think just clarified that it was the Burma Hills patients that will be affected more than working medical centre.
That was all I was going to mention as well, and also to reassure patients at Burma Hills that on Friday, when Burma Hills is switched off, it's switched off. The IT is switched off at lunchtime, so there will be extra clinics in the morning to mop up patients who might need appointments there in the afternoon. But we will still be seeing emergencies at Burma Hills in the afternoon, but we will see those emergency patients at Wokingham. Just to clarify that. But otherwise, I thought it was a really great presentation, and hopefully it's answered everybody's questions. Thank you.
Perfect. Excellent. Okay. In that case, we'll bring it to a close tonight. Thank you, everybody, and good night.